Okay, hello. My name's Dr. Jeannie Knapp, and I'm a GP in Richmond, where I've been working for 15 years after moving from New Zealand. I'm a GP there. I'm also one of the practice owners, and I also have the pleasure of working at the PHN. And this is part 2, identifying and supporting carer needs. So according to the Carers Recognition Act of 2012, a carer should be respected and recognised, both as an individual with their own needs, as a carer, and as someone with special knowledge of the person that they care for. They should be supported as an individual and as a carer, including during changes in the care relationship. They should be recognised for their efforts and dedication as a carer, and for the social and economic contribution to the community arising from their role as a carer. They should have their views and cultural identity taken into account, together with the views, cultural identity, needs, and best interests of the person whom they care, in matters relating to the care relationship. This includes when decisions are made that impact on the carer and the care relationship. They should have their social well-being and health recognised in matters relating to the care relationship, and they should be considered in decision making the effect of being a carer on their participation in employment and education. So opportunities to identify and support carer needs will vary. Some of the carers you see in your practice will be a patient at your practice, or they may attend another practice as a patient. If they are a patient in your practice, consider using whole practice opportunities to identify carer needs. Utilise practice systems, including non-clinical staff. If carers are only attending in their caring role, create opportunities to see them independently. Carers may have difficulty leaving the person they care for to attend appointments, so it is important to offer some flexibility. This might be one of the appointments where an add-on appointment to the patient's appointment to see the carer is very appropriate. What about carers from culturally and linguistically diverse communities? These carers may be harder to reach, as they may not be as engaged with the mainstream system. They may not understand the concept or identify with the term carer, as caring for family members can be a strong part of culture. Carers of culturally and linguistically diverse backgrounds may face additional barriers, such as language and communication difficulties, lack of knowledge or understanding of the mainstream healthcare system, or inadequate access to culturally safe services. And what about carers from Aboriginal and Torres Strait Islander communities? People from Aboriginal and Torres Strait Islander communities are more likely to be carers than non-Indigenous Australians. Aboriginal and Torres Strait Islander carers are also more likely to need assistance with their own care needs, including self-care, mobility, and communication. The impacts for caring may be greater for Aboriginal and Torres Strait Islander carers due to the higher incidence of caring, lower engagement with mainstream health and disability services, and inadequate access to culturally safe services. And carers in LGBTQIA+ communities can face particular challenges. Many LGBTIQA+ people care for a partner, friend, or family member. They face particular challenges in their caring role because of invisibility, discrimination, or exclusion, a lack of recognition of a person's experience, sexuality, gender identity, or the care relationship can add stress to carers in already challenging circumstances. Many carers may be isolated from others in their community by distance, social isolation, financial disadvantage, stigma, and demands related to their role. Limited access to affordable, inclusive services and fear of discrimination can prevent LGBTIQA+ people from seeking services or disclosing their sexuality, gender identity, or intersex status. Caring is challenging for all carers, but the additional layers of challenge for LGBTIQA+ carers is added because of experience of discrimination, fear of discrimination in the community, including from family, friends and peers, employers or other carers, fear of exposure or judgmental attitude from service providers, lack of traditional supports through loss of contact and isolation from family or culture, lack of social and legal recognition of relationships and family of choice. Invisibility in caring situations can lead to isolation and exclusion from decision making, meaning they are unable to advocate for the person they care for. Inability to maintain intimate relationships or to be themselves in care situations, and judgmental attitudes from service providers or other users. So how can we work with carers to support their needs? We need to be flexible with the appointment times that we offer our carers, so that to offer times when the caring duties permit them to access the practice and ensure they have access to after-hours medical support and information. Consider offering carers those first appointments to minimise waiting time, or adding on an appointment when the person they care for comes in for an appointment. Consider booking longer consultations for carers to allow as much as possible to be done to reduce the number of visits required. If the carer is a patient at a different practice, it is still important to check in and ask if they are receiving the support they need. There may still be opportunities for your practice to provide them with support and services. And some tips for a carer-friendly practice. Improve the physical accessibility of your practice so carers can bring patients with a mobility condition or disability into your practice. Offer the carers consultation times when their caring duties permit them to access the general practice. Ensure carers have access to after-hours medical support and information. Regularly obtain feedback from your carers on your appointment bookings, referral and communication systems, and use this information to improve your systems, access and continuity of care. And provide adequate safety netting and follow-up arrangements. Write down information and clinical advice, acknowledging that people may have many other competing needs on them. We all know how important continuity is for providing care for our patients. And so having an identified health professional to liaise with or the same GP to provide care can be immensely helpful for carers. It reduces repetition, saves time, and is reassuring for the carer, knowing that the healthcare professional that they're familiar with and understands the situation they're dealing with. Examine barriers to carer support and ways in which they can be overcome in your field of practice. Use professional interpreters when communicating with patients and carers who are not fluent in English. And put together and provide an information pack for carers and family members to help them in their roles, including culturally relevant and multilingual resources where available. Some other resources and referral pathways include health pathways, carer counselling services such as Carer Gateway and Carers Victoria, and mental health services. Consider using a mental health plan and where possible, refer to services with experience working with carers. And don't forget about the Care in Mind service provided by the PHN. Many services provide respite services, and these vary widely across Victoria. Carers may need to talk to several organisations to see what they offer and how they can help, but Carer Gateway is a good starting point, and the web address is provided below. Peak bodies often have information about support for carers, as well as navigating the NDIS and other parts of the health system. For example, Dementia Australia, MS, Amaze, and Cancer Council Victoria. And there's also peer support available. Local carer support groups can be found through Carers Victoria, and Switchboard Victoria provides peer-driven support service for LGBTIQA plus people, their families, allies, and communities. When caring responsibilities come to an end, carers may question what else they are able to do, with education, employment, and relationships inevitably affected during their time caring. Ongoing support is required during this time. Some problems commonly seen when carers stop caring include feelings of emptiness, loneliness, low self-esteem, depression, anxiety, and poor health as a result of years of self-neglect, stress, and the physical impacts of caring. Every caring experience is different, and how a person copes with life after caring depends very much on the length and complexity of the caring responsibility and the relationship between the carer and the cared for person. It also depends on how it ends. Death of a care recipient may result in a sense of shock, even if the person has been ill for a long time. Carer payments often come to an end within a few weeks of death, and there may be housing issues if the person who has died owned or was a leaseholder of a joint home. Admission into residential care also results in a sense of bereavement. The carer may experience feelings of guilt and anxiety, even though the move is often the only feasible option. Even though the carer will continue to be a carer, albeit from a distance, they may feel a sense of failure. In addition, there may be financial implications, and after many years of really being able to leave the home, the carer may lack confidence in seeking a life away from caring responsibilities. Varying care needs may result in carers moving in and out of a caring role. For example, where a family member misuses alcohol or drugs, has a mental health issue or an eating disorder, carer responsibilities will vary according to the current state of health of the person they care for. Even when that person appears to be coping well, the carer might always have the stress of wondering what the future will bring and uncertainty of not knowing when their help will be needed urgently.